So I think maximum participants have joined us. So I'm going to start today's webinar and I'm going to share my screen with all of you and you have to tell me whether it is visible to you or not. So let me share the screen so that we can start today's webinar. Okay. So can you see it?
Yes, ma'am.
Okay, thank you so much. So let's start today's webinar. Thank you. Okay, kindly, I request to all of you, please switch off your microphone now. And when we will be having a question and answer session, then you can switch it on. So I'm going to start today's topic and I welcome you all in OET webinar. Topic of today's webinar is developing skimming and scanning techniques for OET reading. I have introduced myself. I'm Dr. Maryam Zulfiqar, OET mentor at MedExam Expert. So let's start with the overview of OET reading. We all know that reading is the second subtest of OET exam and it is conducted right after listening part. And the time allocation for this subtest is 1 hour. And it is further consisting of 3 parts, part A, part B, and part C. For part A, you will be having 20 questions. Part B, you will be having 6 short extracts. For part C, you will be having 2 long extracts with 8 questions each. So this was overall the idea of reading part. And because there are a lot of aspirants who are very new to this exam and they even don't know the format of OET reading. So this is for all of them who want to get a general idea of what is OET reading and what is the format and how many questions are there, what is the max distribution. So you can take an idea from here that it is consisting of 3 parts, time allocation is 60 minutes, and further 3 parts is further consisting of 20 questions, 6 questions, and further 16 questions. So as for part A, now we are going in details, and for part A, there are 20 questions. First 7 questions are solved with skimming. Okay, stop there. Now please tell me, what do you guys understand by the word skimming? Who can tell me what is the meaning, literal meaning of skimming?
Just no, not reading anything. Just see the words. That's it.
Okay. Any other person who can describe this word skimming?
It's just scanning the extract, not reading each and every word.
Okay. Okay, both of you are correct to some extent, but let me tell you what. Yeah. Please speak up. Okay, that's good.
I said
okay,
glancing.
You are not clear. Please speak again.
I said just glancing over the things and just getting an idea.
Yes, you are correct. So let me tell you that what actually the skimming is. What you have to do is you just have superficial view of all the 4 passages given. You will be having superficial reading of the text given. Like text A, it is about coronavirus control. Text B, it is about coronavirus symptoms. Text C, it is about recovery period of coronavirus. So what you have gained idea, you have just read the headings. Okay. So when you are going to solve a question, what you have to do is just read the question and go for skimming 4 passages to which it belongs. Because you people have already read the headings. So what you have to do is whenever you are going to solve first 7 questions in which you have to mention the passage name, that from which passage it has been derived. So you have to do is you have to just read the superficial reading. Okay. You have to do the superficial reading of that passage, that whether the recovery time period is given in passage A or passage B and passage C. So you can easily identify it by reading the heading or by reading just few lines from that passage. So you can easily get an idea. Okay, so this is actually the skimming is. Try to correct all 7 of these. Rest of questions are generally fill in the blanks. So it is very important to understand the proper format of OET reading before solving it. Okay, so I'm going to tell you that it is the most easiest part of the OET reading. And try to score 20 out of 20 in this, because we all know that OET reading part C is the most difficult one. So it's better to gain maximum marks in part A and part B. So for part A, read questions first, then write the answer. Be fast and active in this subtest, as you won't be given this booklet after 15 minutes. This is the very important point to consider here, because the candidate thinks that if he is given a time allocation of 60 minutes, then it is not the whole 60 minutes for solving whole reading subtest. You have to be familiar and you have to understand this thing, that whenever you are giving the answer booklet of reading part, you will be given separately 15 minutes for solving part A, and then you will be given 45 minutes for solving part B and part C. So this is the thing you have to understand, because after that completion of that 15 minutes, you won't be given the answer booklet of part A. So it is the very big misconception in our aspirants. They think that they will be having a full complete 60 minutes for solving reading subtest, but it is not correct. Okay, so try to solve part A in that 15 minutes, like the first 15 minutes, and then part B and part C will be solved in 45 minutes. And there is also a trick, like for part B, you should invest 15 minutes or 20 minutes. And for part C, please make around 30 or 35 minutes for solving that part, because it is the most difficult and it is a very lengthy subtest to solve. So try to score maximum in this subtest. That will help you in acing the desired score. Don't leave any question unanswered. This is another, sorry, this is another important point to consider, because candidate think that if he or she is going to write anything incorrect, then what happened? He or she thinks that maybe there is a negative marking and I won't do this. So this is not correct. What you have to do is never ever leave anything blank. Whatever you have understood, whatever you think that it is right or even it is wrong, please try to fill that blank, because it may give you an edge that maybe you are right and maybe you are correct. So it can give you marks. So never ever leave that blank unanswered. So now let's come to part B. I have told you there are 6 short extracts and you will be given 3 options to mark the correct one. Read the question first, then jump to the extract. Try to understand the gist of the passage. This is the very important thing. Whenever you are going to solve part B and you will be given the question and answer booklet of that part, first understand the gist of the passage, that what is actually the passage means, that what is actually writer and the author wants to say. Underline the keywords. This is another important thing for part B. Always underline the keywords, because it will help you in identifying the answer. Okay, because the thing is, when you underline the keywords, answer is around and above and below that keyword. It is a trick. Please keep it in focus and remember my words. When you highlight the keywords, answer is always around that word or in the same line, in the same statement, above that line, below that line. But keyword will help you in identifying the real answer. So then read the options. Start with elimination. Elimination helps you a lot in OET reading B and C, because when you start to eliminate the options, you will directly read to the answer. After reading the passage, with the help of skimming and scanning, you think that answer C is not correct. Please try to put cross after that. Answer C is cancelled now. Now you have to choose among A and B. So what you are going to do is, you think that B is also not correct. Please cancel the statement. Now you are having only one statement, which is statement A, option A. It is the answer. So with the help of elimination method, it is easy for you to reach the correct answer. Always try this technique. You will easily find an answer without any hesitation, because if you don't try this method, you are always confused between 2 or 3 options for part B and part C. But if you try this method, then if you are canceling the 2 options and there is only one option left, then it would be easy for you to reach the right answer. I have told you, then cut it for your ease. It will help you in finding the correct answer. If you are confused between 2 options, then leave that question there. Okay? Jump to the next question for saving time. It is you can say that it is a golden tip for solving part B, because we have to save our time for part C. It is the lengthiest subtest, okay? So what you have to do is, in part B, if you are still confused between 2 options, like you think that A is also correct, B is also correct, what I have to do? Please leave that question there and jump to the next one. You have not a minute to lose. You have not even a second to lose. Then why are you wasting your time on that question? Please jump to the next question. Try to solve that question. And after completing the whole part B and part C, then move to that question which you have left and then try to solve it. Okay? Students do what? They waste a lot of time on the question in which they are confused. And what is the result of this this blunder? They leave most of the question unanswered because time is up till now, like they are deciding which option is correct, A or B is correct. All of you, please turn off your microphone. Thank you. So after solving rest of the question, then try to solve the unanswered question again. Okay, so this is the golden tip to save your time. Now come to part C, and you all must be knowing that part C is the most difficult one, because it is the long extract and then you have to solve 8 questions. So there are 2 long extracts with 8 questions each. Leave the extract at that point. Just go for questions, okay? Don't ever try to read that lengthy passage at the start. What you have to do is, when you are going to solve part C, what you have to do is just go for questions only. Read question 1 along with options, then come back to passage again, okay? The wonderful tip and trick to solve part C is, first read the questions and then come back to the passage. Along with question, you have to read the options as well. You are having 8 questions, then number the paragraphs till 8. Whenever you are coming back to passages for reading, then what you have to do is, you have to number the paragraphs from 1 to 8. If they are more than 8, then you can number forward like 9, 10, 11, whatever the number is. Then follow the sequential order. Now listen to me very carefully, because a lot of queries were there for solving part B and part C. I have told you about part B, and I will also discuss some of the things in the upcoming slides for part B. But the thing is, now listen to me carefully for solving part C. Follow sequential order. Answer for question 1 will be given in paragraph 1 for sure. If you find keyword for question 1 in the same paragraph. Okay, so the thing is, candidate is confused between where is the answer actually present is, like I have read the passage 1, there is nothing like that, whatever the author has asked, and then he or she is going for paragraph 2, paragraph 3. So mark my words, follow sequential order. Answer for question 1 will always be given in paragraph number 1. if you have find the keywords for question 1 in the same paragraph. Don't move here and there to look for answers in between different paragraphs, because you are losing your time, you are wasting your time. If you think that you will find answer of question 1 in paragraph number 4 or paragraph number 5, then you are totally wasting your time. And it is the reason of failure in OET reading. Sequence is very necessary to follow. If you are unable to find any answer, move to the next question to save time. Keywords are very essential to identify. Try to solve this part in 30 minutes. So you should try keeping 30 minutes left after solving part B. I have told you, you will be given complete time of 45 minutes for solving part B and part C. So it is advisable that you should complete part B in 15 to 20 minutes. And for part C, you must be having 30 or 35 minutes. In that 30 or 35 minutes, you have sufficient time to solve this lengthy part. Okay. So always have 30 or 35 minutes left for part C. But what a candidate do, there are only 10 to 15 minutes left, and then they start solving part C. So it is the big reason of their failure. So OET reading is all about time management and practice. More you practice, more you score. And the other thing is time management. Time management is also learned with the help of practice. Okay. So now comes to skimming and scanning techniques. Skimming technique is basically applied to part A. It means you just have to do superficial reading of passages for picking out the answers. So this was my question in the first slide, that what is actually what is actual and literal meaning of skimming. So here is your answer. It means you just have to do superficial reading of passages. It is very easy and time-saving technique for part A, as this part is actually the game of nerves, and you have to control on yourself and don't get panic. You can easily solve part A in around 13 minutes through skimming. Okay, on average, because I used to take reading sessions as well. And when I used to take and used to do exercises with a student, if a student is capable enough and she or he has practiced enough, then on average, he or she only takes 13 minutes to solve part A. Okay, understand this thing. And this is all about the game of practice. First, read the question, then find answer. Scanning is basically applied to part B and part C. It means you have to be active scanner-like view on the lines given, where you have highlighted the keywords, as most of the time answer is present above or below that line, or even in the same line. So what you have learned, skimming is basically applied to part A of reading, and scanning is applied to part B and part C of OET reading. And you have to be an active scanner where you have highlighted the keyword. Skimming and scanning techniques can only be developed with a lot of practice. And to be very honest, to be very practical, I am going to tell you, you must solve 25 to 30 tests before appearing in the real exam. Please mark my words, mark in writing, do whatever you want. Make a screenshot. You must solve 25 to 30 tests before appearing in the real exam if you really want to ace the OET exam. So I'm going to conduct few exercises with all of you. And I have told you about skimming and scanning. Now we will apply the techniques of skimming and scanning to the exercises given. And you all have to tell me that what are the actual answers. So here you can see on your screens, the texts are given: text A, text 2, text 3, text 4, and it is about total knee replacement. And then you will be having questions on your screen, question 1 to 7. So who can tell me the answer of question 1, the symptoms to check for during clinical assessment? Here are your texts.
Text 2.
Text 2. Okay. Okay,
Text
okay. And I will show you the correct key at the end. And there is another thing. If you people are not a part of our free WhatsApp group, then you can easily submit your answers there in our free group. Our team will share the link of our free group. Ramesh and Yusuf, if you are present, kindly share the link of our free group so that it would be easy for all the candidates to submit their answers in our group. And after that, I will surely share the answer key on our screen. Now solve question 2, which is the timeline to full recovery. Here are the texts.
Text D.
Text D. Okay. Now the question 3 says that smaller operations as alternative to knee replacement. Smaller operations as alternative to knee replacement.
B. Text 1.
Text 1.
Text 1.
Okay. Okay. So while solving these questions, you can easily see that for text 1, there is a heading, total knee replacement. For text 2, you can see that clinical assessment. Text 3, you can see here potential complications. And for text 4, you can see that post-op care. Okay. So you can get an idea from reading the question that in which text my answer is lined. So now for question 4, post-op care following knee replacement. So it is very easy by reading the heading, like post-op care is mentioned in text 4. So answer must be in text 4. So all of you kindly solve question 1 to 7. You have 3 to 4 minutes for solving it. And after that, we will proceed to the part B for solving. Kindly submit your answers after writing in our free WhatsApp group. And please be a part of our WhatsApp group in which we used to do daily activities. And after that, I will show you the correct key. Please solve all the 7 questions, just first 7 questions. And then we will proceed to part B.
Can you hear me? Hello.
Yes, I can hear you.
The text is not clear. I can't see the text.
Now, is it okay for you?
Excuse me, ma'am. Shall I need to read only text 1 or text 4? I missed that part.
If you think that answer is present in text 1, then you can only read that part. If you think that answer is present in text 4, then you can read that part. It's totally up to you.
Okay, ma'am.
Anyhow, the time is up. And if any one of you is has not answered all the question, like question 1 to 7, then I can share these questions at the end of the webinar in our free group, and you can answer it there. So don't worry about it. It was just a usual practice for solving the part A, and I was just to tell you that how can we apply the skimming technique to part A. So this was all about for the proper understanding of skimming technique, which we really apply to part A. Now we are going to proceed part B. And now you can see here on your screens that there is an extract from OET reading part B, which is the article on clinical inertia in diabetes. Now I'm going to read that passage in front of you, and then you have to choose the correct option. Okay, we will start from the question first, and then I will go to the passage. After reading that question, I will go to the passage for highlighting the keywords. And then after reading that passage, I will use the elimination method to mark the correct answer. So the question is, what reasons does the article give for patients preferring lifestyle changes if their blood sugars are raised? This is the question. Now comes to the passage. It is the article on clinical inertia in diabetes. The term clinical inertia implies that the provider is to blame when a patient does not receive adequate treatment intensification. In reality, multiple factors related to physician, patient, and systems contribute to this phenomenon. Intensifying diabetes treatment can require multiple oral and injected medication, finger stick glucose monitoring, and significant lifestyle modification. Okay, stop here. What I am doing? I'm reading the whole passage and I'm not even finding the answer here and there. Okay, now have a bird eye view, superficial reading. Now you can see easily that in line number like around 5 to 6, you can see there's a line. These circumstances can lead to distress and resistance to new medication, particularly injectables, for example, insulin, GLP-1 receptor analog, which many initially refuse to use. The rising out-of-pocket cost of diabetes medication can lead patients and providers to feel reluctant to initiate new medication. Patients may thus prefer to first try lifestyle modification as a response to elevate blood sugars. Now, what I have found the keyword lifestyle modification, which was asked in the question. Now mark it. Now comes to the option. Option A is saying ongoing suffering with existing illness, opposition to injectables, and increased expense. Okay, we will consider it because he was just asking us the reason. Does the article give for patient preferring, why the patients are preferring lifestyle changes if their blood sugar are raised? So this can be the answer, like ongoing suffering with existing illness, opposition to injectables, and increased expense. Because we have read here, like in the third last line, we can read rising out-of-pocket cost of diabetes medication can lead many patients to providers to feel reluctant to initiate new medications. So it can be the answer. So leave it here. Now comes to answer B, which is lack of engagement with injectables and lack of understanding of the rationale for using them. We haven't read anything like that, so cross it. Pain from using injectables and reluctance by a physician to start a new treatment. We haven't read anything like that, so we can easily eliminate it out. So what do you guys think? That in my opinion, answer is A. I might be the wrong. I'm not saying I am correct, but by that elimination method and by that scanning technique, I think that answer is A. So what do you guys think that? What is your opinion about the answer of this extract? Please tell me. I'm waiting for your answers. Any one of you?
A, ma'am.
Okay, you think the answer is A. And why do you think that answer is A?
Because the key point available in the last
Yes.
5 lines.
Exactly. You are very correct. And that's why I have chosen the answer A, because I have already highlighted the keyword when I was reading the paragraph. And it helped me in finding the answer, because I have told you in the above slides that whenever you are going to highlight the keyword, answer is above or around or below or in the same line. So what I have done is I have highlighted the keyword like lifestyle modification, and it has helped me in finding out the correct answer. And by eliminating options B and option C, I am only having option A, which is the correct one. So this was my strategy and this was my technique to solving that part. And I think that today you all have understood how to solve part A, part B, and part C of reading. So here are answers. You all can see that for part B, extract, correct answer is A. And this is the answer key of part A, which you have to solve like question 1 to 7. You can easily make a screenshot of it and you can solve it and then you can see the answers. So this was all about today's webinar. And if you guys have any question, any query still sticking in your mind, you can please ask me.
Excuse me, ma'am. Can you show me the answer option, please?
You can take a
No.
screenshot.
Option, madam. Option.
Sorry.
I want to see that option A, B, C, like answer.
I have shown you the
I'm
answer
reading
by-
part A actually.
Okay. So here is the correct key of part A. Please take a screenshot and then you can solve it at the end of the webinar.
Thank you, ma'am.
You're welcome. So let's come to the question answer session. So if you are having any question in your mind, please ask me. And there is
Ma'am,
another.
excuse me,
Yeah, please
ma'am.
speak up.
Ma'am, you said we underline the keywords. Is it allowed in exam, or we have to remove? We have to erase the underline in the
You
real
have
exam.
to erase, you have to erase that word after solving that subtest. And like for underlining and for highlighting, it doesn't mean that you have to be with your highlighter and you have to highlight that word. It means you have just like you have to just mark it slightly with the pencil, because after that you have to erase each and everything you have brought on your paper. Okay, and this is very important point to consider, and that's a very good question by the one who has asked it, because it will like it will erase your confusion out. And in any of the subtest, if you have written each and every word, you have to please you have to make sure that you have erased it, because it will lead to cancellation of your paper. So it is very important thing to understand. And after highlighting, just make sure that you have slightly marked it. And after solving, you have to erase it. So that's a very good question. And I think that a lot of student can get help from this question. So any other question?
Thank you.
You're welcome. Okay, before any question, I want to make another announcement to that. We are going to start our OET regular course on 15th of April, and our registration has started. And if any one of you is interested in our course, then he or she can easily enroll himself or herself. There is the schedule of OET live course, and duration is 1 month. And you will be having 16 live sessions for the 4 modules, like 4 for listening, 4 reading, 4 writing, and 4 speaking. And not only the live sessions, if in any case you may miss your session, you will be given a recording for that. And for practice material, you will be there is an other important news that we are updating our practicing material, and we have started work on it, and almost 75 to 80% of our material has been updated on our website. And it is for those students who are going to enroll themselves in our course, which is going to start on 15th of April. So it is very exciting news because we are updating our material, and because a lot of students are in use of the updated material, like they ask us for the updated material because they have tried all of the other material which they found on any other websites. So this is very amazing news as well. And after that live session, you will be having 3 letter writing assessment with proper feedback. Because we in the proper feedback, we are not going to tell you only the grade and the score. You will be having your detailed feedback, like whether you have organized the paragraphs carefully, what about your layout, what about your grammar, what about your word count, and your clarity, purpose, coherence. You will be assessed on each and every factor, just like the real exam. And you will be having study room guidance, session recordings, and 24/7 technical support. So regarding practicing material, you will be having reading exercises with answer keys, listening exercises with answer keys, speaking role play cards, and writing case notes for practice. And I've told you, you will be having 16 live sessions in a 1 month, and 4 sessions for each module. And here is our OET assessment plan. So we started with level 1, and we are having 3 levels. Level 1 is for those who haven't started preparing yet. And it will be having 8 letter writing assessment, 10 reading mocks, 10 listening mocks, and 1-on-1 free speaking mock. And for those who have 50-50 preparation, they lie on level 2. And you will be having 5 letter writing assessment, 5 reading mocks, 5 listening mocks, and 1 speaking mock. And for those who just need a final revision and who are in their revision phase, they are categorized in level 3, and they need 3 letter writing assessment, 3 reading mock, 3 listening mock, 1-on-1 free speaking mock. So this was all about our OET regular course and our OET mock exam. And for mock exam, those students who are interested in our mock exam, they can easily contact us. They can contact me. They can contact Ramesh. They can contact Faizan. They can contact Yusuf. Our session team, please share all of the number of our registration team so that you can easily enroll yourself in the OET course. And now, if you guys have any question, we can discuss it here. Yes. And I can see in the comment box, there are a lot of queries. Okay. Is it allowed to underline? I have answered it already. There is no voice. Could you please increase the volume? Okay. Okay, Ramesh has shared the group, link of our WhatsApp group. Please join it. Thanks, ma'am, and facilitators for all of your efforts. You're welcome. Ma'am, for nurses, yes, for nurses as well. We are having our course for nurses as well. Okay, Ramesh has shared. Okay, Dr. Shaheen is asking for joining mock. So Ramesh, please contact Dr. Shaheen. And Dr. Shaheen, you can easily contact on the number given and you can register yourself for the mock exam. Is the Ramadan discount applicable on the OET mock test? You can get this information by contacting Ramesh. Okay, so this was all about our webinar. And still, if you guys have any query and any question in your mind, please ask so that we can end our webinar after that.